This meeting is being recorded.
Right. In the last session, we have discussed about, I think some codes we have discussed,
Yes.
the balance one, the balance claim related codes. All that.
We
right?
had
That's what we have.
ended at T set 277.
Yeah, that's what those codes we have.
Yeah.
Right? That's
Yes.
In today's session, I'm going to explain you about the facets part because, especially in context to the claim processing, in the healthcare, actually, generally we have two applications. One is major applications, which normally we uses are two. The first is called facets and second is called QNext, two applications. But majorly, of course, major usage will be on facets application.
Okay.
The facets is a kind of application which will be used. It's like an ERP kind, because ERP means enterprise resource planning.
Right.
Means whatever the departments we have in any of the organization, to streamline all the business processes as well as the activities to make it something unite and to make it stable, generally ERP applications we uses.
Okay.
So ERP, it's nothing but enterprise resource planning in detail, we call it as. So there are a lot of ERP applications out of healthcare. We have something like SAP, right? So Oracle related ERP, there were a lot of applications. So whereas especially in the field of healthcare, prominent applications were facets and QNext. So this QNext is a kind of application which will be majorly used by the payer nothing but the insurance companies, because they are the one who will be receiving the claim request from different providers like healthcare providers and all. So based on the request what they have received, whatever the process they require to follow will be done by them, right? So when we talk about facets, it's an ERP claim related application which will be used majorly by insurance companies, majorly to manage this claim processings, all that, because claim forms will be received from the different providers. And whatever the forms they will be sending us are different things, because last time also we have discussed, right? 275 could be 277.
Right.
Could be 835, 837, etc. Different forms, different forms. Because again, these forms are differentiated in three things. One is about based upon the codes, whatever the procedure codes they follow will be as separate, and diagnosis codes will be as separate, and finally claim codes will be as separate. So there are three different differentiations we can see between. So different codes, different forms will be presented by the providers to the insurance companies, wherein this facets application wants to streamline all that. That is what generally the major advantage under facets was. Now, when we see facets application on a high level note, what are the different features which are available or functionalities which are available under facets are as follows. The first was consumer retail products. Retail products, I'm talking about insurance products. Okay, please. Okay. Because if you remember in the beginning time, even I told you, insurance company will have different insurance products. Because earlier, if you see insurance plan, if you talk about insurance plan, there will be only one insurance plan. Now, after that in healthcare, based upon the specialization, either it could be cardiology or it could be neurology or it could be of any other things. Insurance products were also designed in such a way where exclusive products will be given to the customers. Okay, that's how the transformation happened. Of course, end of the day, this is all to protect the customer's health. Insurance companies has to make some research out of it, and they have to come up with some different products. Because if you remember, earlier insurance plan means only one, right? So complete insurance plan, which will be covered everything. After that, now the insurance plans are different for different things. Different insurance plans came with a normal premium or a high premium of that sort. That's how the transformation happened. So when the payers, when the insurance companies or it could be Medicare or Medicaid CMS people, whoever is using it, this software will have all the details about the consumer retail products. Of course, that depends on the kind of products which those organizations will follow, right? So that sort of customization in reference to the consumer retail products has to be updated. It is point number one. Second, there are two things. Again, one is HSA and second is FSA. You can make a screenshot. Okay.
Yeah, I
One
did.
is HSA and second is FSA. HSA is a health savings account management system, which majorly focuses more on health savings of people, whoever is performing all this. At the same time, flexible saving account. There are two different, I can say, modules, right? So essentially, I can say HSA is one module and FSA is one more module. HSA is completely health savings account module, wherein FSA stands for flexible savings account module. These are the two different modules we have, apart from consumer retail products we have. The next one about Medicare and Medicaid as separate. You know that, right? So again, in Medicare, there will be 4 classifications,
right,
which are A, B, C, D.
right.
In context to the Medicaid, there will be only one. Of course, the rules and regulations based on the geographical location of that particular state, it may vary. But details about the Medicare and Medicaid will be there in the system itself, which will be predefined and which people have to update. But there must be a provision we have to make out of it when there is an application of FACETS and payer is taking from the company, because FACETS belongs to like Trezito, right? Trezito is a parent company. FACETS is an application name, I can say. Trezito is a company by itself, right? So who owns this FACETS is called FACETS called Trezito. So customization will be taken by the payers, because an insurance company called X, who is a payer, is using this FACETS application, means structure of claim management system application and the kind of modules, whatever is required, remain constant everywhere. That never changes, right? Because any payer, any insurance company, whatever the business process they follow remains same. You don't see any difference in that, isn't it?
Right.
You don't see.
Right.
But whereas when it comes to the organization to organization, whatever the products they will be using in real environment, either maybe a specialized insurance products for a particular health related plan might be introduced by the private insurance players. Or else there must be some provision for us to make some changes in the existing Medicare and Medicaid whenever there is a government decision was taken, right?
Right.
That customization is required. So,
right.
Overall claim management system, whatever FACETS we payer as users and all, everything applications remain same. But customization will be made. Customization, minor, mostly it will be minor. Minor customization according to the business rules of that particular organization, whoever has taken that product. At the same time, based upon the kind of changes they might require to do in coming days, right? So it depends on, because as I told you, for example, there will be some changes which a federal government has changed in Medicare plans. Let's say, for example, right? If there was any decision, because every year budget will be submitted, right? So every year annual budget will be there. In that annual budget, government has to allocate some funds for for different things, right? For education, this much percentage.
Right.
For health, this much percentage. That's how generally that allocation will be done by any government, right? So,
Right.
because out of 100%, for example, 100 out of 100%, simply to understand what I'm saying, right? 10% for this, 15% for this, 20% for this, 30%. This is how generally this distribution will be made.
Right.
This distribution depends on the kind of government policy and where they want to give more importance usually, right? So where we have to give more importance, that depends on the government policy.
Right.
Usually any government policy, there are two major things, welfare activities they see. One is education and second is health. Any government across world, any budget, whenever they proposes, two are major, of course, remaining security and all everything that will comes under, but majorly because these are the two regular things. Because people health is important, people education is important, right? So they have to give. So every year there will be some budget will be allocated, and whatever the kind of environmental changes, right, happens because any medical emergencies across the world were happened, right? So due to any other reasons, all that, there will be some changes will be done by the government subsequently to protect the healthcare expenses of an individuals, right? As an example, the kind of situation we have faced 2 years back, right? So which was never expected by the people, but people were across the world were suffered for 2 years.
Right.
Earlier, there was no virus as such, nobody knows. So there is no insurance claim for that, right? After that, governments has taken active initiation across the world, all the governments across countries, and they have included, I think, I'm not sure 100%, but usually people have tried to include that expenses in the insurance itself, so that people may not suffer by paying by paying through cash, may not be possible for all the people. Maybe that percentage is very limited. So these kind of changes might require to make some doing it, right? So this is where generally this Medicare or Medicaid standard rules and regulations, whatever the procedures generally we need to follow, that remains constant, that never changes. But subject to correction, as I mentioned you, there must be a provision to make some customization, which is essentially required, and we have to make some changes out of it, right? So this is where generally Medicare and Medicaid come into picture.
Right.
Next was care management, because normally in management in healthcare we discuss about two things, Shalini. One is care management, second is case management. I'm going to discuss about in coming days, of course. I will show you care management and case management. I will discuss that, right? So there is a process of care management. You can see care management, right? So classification of care management, so all that. So of course that I'm going to discuss in coming sessions to you. Right. So care management and case management will be there. So details over care management and case management, that is also providers mentioned, will be mentioned here. At the same time, provider network management. Provider network management means whoever is the healthcare providers, and it can be hospitals, it could be healthcare clinics, right? It could be clinics, it could be nursing care, right? So their details based upon the network A and B, based upon the network, in whichever the network that person belongs to. So wherever all these things are available, every information will be mentioned under this application. So these are the major modules, I can say. Major modules are the features which will be there in the FACETS application. Right?
Yes.
Now, these are the features. These are the key features, I can say. Whatever I can say, those I can context to an extent possible, I can say it is modules to you to understand simple, but these are the features. The features is that this is an application which will be used best suited solution for healthcare management in regular, as in when we are using it. At the same time, this is an application which will be effectively managing all the care products within the healthcare organizations which people are using it. And moreover, apart from all, any application, if any application want to have a commercial success, user friendliness in context to the user interfaces are important. That is needed.
Right.
For example, there is an application which a solution provider has designed. Even though it has all the features and functionalities, the targeted customers may be of different people, right? So targeted customers may not be the one category, right? So they may be from different these things.
Right.
So user friendliness of that particular user interface is also required, because we have to give importance for the security of the application that is needed, of course. But equally, along with security of the application, we need to provide the user friendliness to the user interfaces also. That is also essentially needed. This is what we call it as user friendly user interfaces and all. So this is also one of the feature normally we use it. At the same time, it allows great security level. As I mentioned, security levels are also important. So we have to provide security levels for security levels for the kind of user roles and as well as access level management, because whenever I have explained about HIPAA, I told you, right? So there are 3 services will be there, right? So one is about administrative activities. In that administrative activities, multiple roles will be there, right? There may be an admin person who is doing the billing, biller is there, right? So different roles are there. So
Right.
these are the user roles. Of course, admin is an access level role because there are 2 things. One is user role and access level roles. User roles means people who are using application. They are trained to use the application. What are the information which is available with us? They have to update that information. That's what generally user roles are. But whereas when it comes to access levels and all, that will be given to the people, whoever is doing the administrative activities, maybe administrators, right? Whoever is playing administrator role. Because every application will have an administrator, because all the applications now and then were slowly moving into the cloud environment. Infrastructure, even platform, software, everything will be provided in cloud. Being a user or a person who is providing a solution or a user need not install any application, mostly, because that's how the transformation is taking place. Simply what they can do, using the valid login credentials, they can log into the existing application, and whatever the necessary necessary usages they want to use, they can use it. That's how the applications were transformed. But still, there are some user roles, as I told you, like users like billers and all, everything were there. So security will be given when they are managing their applications and all. Security will be given to them, but that is connecting only to the user levels. That's what it was, right? So user level roles it was. They are only trying to use the application, and restrictions will be given depends on the kind of role they were playing. At the same time, access level will be given for administrators. Sometimes multiple accesses will be given to multiple people even, because administrator may not be available all the times.
Right.
Right. So multiple access levels and all. So these security levels, if we want to follow the security levels, again, I'm going back and I'm explaining when I'm talking about HIPAA standards, right?
Right.
So whenever this application was built, or whenever the application has started building the FACETS and all everything, people have to follow HIPAA transactions that they have to, because it has to build from the scratch, because you cannot develop the security level applications once the application was all live, right? Which you can't do it.
Right.
Am I right or not? Right. So security level features, security level transactions, if you want to make, when we are developing the product, we have to make changes in that level. We have to make there, not once the product is delivered and product is on live state, right? Which is not acceptable, which is not equally not possible. So security level features has to be added to the existing application of facets based upon the HIPAA rules and regulations. Again, those HIPAA rules and regulations, whatever the features they were generating, again will be differentiated into 3 different parts. So one is, as I told you, like administrative roles, whoever is managing the application.
Right.
Second is for infrastructure level security, because the kind of systems they were using and all, everything must be highly configured and highly secured systems. It must be not the regular systems what we use for different purposes and all that, because whatever the transactions they were sending, everything will be in encrypted format. So systems, even systems, if someone is using, either you are building, developing a product or you are using an application, there are the guidelines of HIPAA which has to be followed by everyone. Either it could be a provider or it could be a payer. Because providers means healthcare providers, payer nothing but insurance companies or CMS, Medicare or Medicaid people. Everybody has to follow the security levels. Next, security levels to make it more intense, to increase with even claims related codes and all, everything will also be inbuilt in it. So these are the key features we have in context to the facets part. Is it clear to you?
Yes.
Shalini, right?
Yes.
Now, what are the application groups we have, right? So because especially in context to the application you see, because of course, usually as I told you, because application access won't be there, because it's a premium application, we don't get any trial versions for that. Organizations will use it, but to an extent possible, you need to have a live exposure. Hence, of course, I'll be explaining those procedures in coming days. But these are the application groups you need to know. So first is about accounting. Accounting groups has to be created, because whatever the financials and all, everything will be updated over there. Next, accumulators, whatever the accumulation you want to make out of it, that also will be added in the application group. Next, application support. Application support means there might be some kind of applications which are required for us to have some support, some third-party applications, maybe to have more security, more safety. We may be required some other application support groups which may be required for us. Understand, right? Third-party tools, right? So to have more security, you may be required some third-party tools to be upgraded. Or you may be required some kind of DevOps tools to be added into this, because nowadays, most of the developments happens in the DevOps environment. DevOps environment means application. For example, you are a developer. Let me put you this way. You are a developer wherein you are developing an application. You are writing some code, testing everything. Now, what other people, there will be another team which is called operations team. Operations team means whatever the work was done by you guys, your team, will be deployed by these people at the client environment. And they have to ensure that the client environment, according to the client requirement, according to the client infrastructure, whether this application is performing well or not, that they have to cross-check. So once they feel that, yes, it's working according to that, then application will be delivered subsequently. That's how generally the process is. But actually, in the regular, before DevOps, what would have been happen is, what usually earlier used to happen is, whatever the changes you want to make in the existing, for example, you want to make any changes on the existing application, again, you have to go back to the phase of analysis or planning and design. You need to make some changes out of it. So this could be impacting the amount of time people were investing. When the time is more, automatically budget will also get increased, so that it leads to the complexity. Technical complexity will also be increased equally. So to manage and to address these problems, they have invented a concept called DevOps environment, right? So why I'm talking about, because application support, in context to this, I'm explaining this point as an example. DevOps environment means both the development team and operations team will also work on the same platform. So there will be a proper coordination among the same team, because there is no development team and operation team as separate. Earlier it was. When the DevOps environment has introduced, there are different people who are working under the DevOps environment is called DevOps engineers. DevOps engineers. These people should have a knowledge over development and operations both simultaneously, right? So if, for example, if one X is a person or a Y is the person who is working on development and both operations, so that coordination will be much easier for them. So that the complexity will come down, the amount of time they were spending will be more easily manageable to them. But this can't be done manually because there are different tools, something like Jenkins for integration, Kubernetes, Ansible, Negois. Different DevOps tools will be used by the technical people to manage. So subject to condition, as I mentioned you, coming back to the application groups, if there are any kind of applications, something like DevOps environment, which was introduced, wherein we need to add something to the existing ones. This is where generally this application supports as an example, which will be used. Understood, Shalini, right?
Yes.
Next is benefit configuration, right? You know that, right? So benefit configuration means whatever the benefits or beneficiaries need to be at. So that has to be configured equally. That benefit management system, that's what we call it as separate. That has to be configured in the application. But again, this benefit configuration depends on the type of benefit it belongs to. That configurations should also be there in this application group so that it will be here. Next is billing, because you know about billing, nothing much to explain. Next is HIPAA privacy, as I told you, right? So whatever the HIPAA rules and regulations were there, those will also be a part of this application group. So whoever is working on the application of FACETS and all should have an idea over HIPAA rules and regulations first. Because where we have to impose this, where we have to include this HIPAA guidelines, development team should have a knowledge first. Development team means even business analyst, right? Being a BE, you need to have a knowledge, right? So where these HIPAA rules and regulations in HIPAA guidelines, because you may not be required in every stage of application, okay? You may be required in some areas. This HIPAA guidelines and rules need to be imposed, need to be inserted, need to be implemented, applied. So this is where generally this HIPAA privacies and all everything come into picture. Next, capitation followed by this claim processing and all everything will also be included in this application groups, because you know about claim processing and capitation. Next is about claim processing in reference to the process of the transactions we are making with other people. At the same time, commissioning, because for every claims and all everything, there will be some amount of commissioning system will also be involved in it for all the transactions. That also will be a part of application groups. Next, criteria has to be mentioned equally, because criteria of qualification criteria or acceptance criteria, I can say. Because when there are any features or any functionalities you want to add in next coming days or coming time, there are some criteria we have to follow. Understand, right?
Yes.
Some criteria has to be followed in between, right? So because these criteria, again, these criteria guidelines will be there. Subject to those criteria, things will be updated accordingly, right? That's how generally these criteria and all everything will be working. So not only commissioning, even criteria will also be mentioned. Acceptance or qualification criteria, I can say. Because if you want to make any kind of updations to the existing ones, there will be an qualification criteria which is involved in it. So that has to be updated subsequently here.
Right.
Next, customer service. Okay, this is a continuous plan, you know it, right? So whatever the customer services we are making, right? So all these things will also be included in it, right? So customer services, right? So all these things will be included in the existing ones. Because customer services may be here in context to customer service, they may require this FACET application will be managed using some CRM applications. If you remember, there is an application called Salesforce CRM. Have you remembered that?
Right.
You know that?
Yes. Yes.
Right. Salesforce is a CRM application which will be used to manage sales processes of the sales. Right. At the same time, not only sales, even marketing, all that stuff. Right.
Right.
Marketing, all that stuff. So in this context, generally what happen whenever we are working on this, usually There is a feature nowadays which is of course not recent. Last couple of years, since last 2.5-3 years, it was more. There is a cloud account called Health Cloud. You might have heard about it,
I have, yes.
right? Health Cloud, right? So Health Cloud
Right.
is an application which was introduced where I don't need to explain in detail. And there is an application called Epic, right? Epic will be patient
yes.
management software organization uses.
Yes.
This healthcare application for Epic, this health cloud application can be integrated with, right?
Okay.
So that even doctors' appointments and all everything, they can make it more easier. Right? They can make more easier and all everything, right? So this is what it was. So that's where generally this customer services and all everything comes. Means if they want any customer service, there need to be a provision for integration purposes, which you want to make some integration out of it. So integrations will also be included in it, right? So either it could be Salesforce CRM, or it could be an health cloud or something like. All these things comes under this category, because FACETS itself exclusively 100% won't provide you the customer service, because as it is being built under the ERP application, right? Some kind of CRM integration might also require, subject to the organization to organization, it will vary. Next, about dental plans, right? So dental plans, dental provider agreements. Next is about FSA plans we talk about. FSA plans means flexible spending account plans, we call it as. Usually this flexible spending account plans where we have to see like the kind of information or the kind of money people were putting in. So this is also something comes under this as FSA planning, all that stuff.
Okay.
At the same time, whatever the different application supports in reference to the healthcare, whatever we are using, even that also will be included in it, because we need to have a clear support about all this, right? ITS application plans and all everything. So that's all of IT application support is required. Even IT's plans and all everything, it should also be included in it. So these are the major ones. Of course, these are the major ones. Whatever I have discussed with you: claim processing, claim application support, ITS plans, all that. But addition to these things, whatever I have explained about claim processing and all, in connect to that, these are the things. One is about medical plan. Whichever the medical plan that person has belonged, we need to have a choice to select that. At the same time, you need to have an option for provider network, right? Whichever the provider network they belongs to, that has to be added. At the same time, even provider agreement and pricing profile, whatever the provider agreement, if there is any, that provider agreement has to be updated here equally. Terms and conditions will be mentioned in it. At the same time, pricing profile, because as I told you, right? So different pricings for different services. Next, details about the provider and subscriber.
Right.
Followed by this utilization management, right? So how are we utilizing this, and workflow configurations, because this is where generally this admin people will be focused more on, because workflow is so important, especially in the field of healthcare. The workflow is important. How you are creating workflows, all that stuff. Of course, being a business analyst, we'll be focusing on workflows also. Okay, that is important. Because how to do this workflows and workflow management and creating more workflows and all everything is also required. Of course, configuration and all, some people have some administration experience. If any business analyst or someone has some admin experience and all, they have to configure these workflows, configurations and all with other systems. Because multiple systems will be connected in the healthcare organizations and payers and all everything. That workflow configuration should also be included in it. Understood, Shalini? Clear?
Yes.
So these are the application groups which comes under FACETS.
Okay.
So this is all about an overall understanding about FACETS part. And tomorrow I'm going to discuss about the process steps, right? So different processes. How do we do? In what way, being a business analyst, we will be connecting to that. That part I'm going to discuss in tomorrow's session. Do you have any questions on this regard?
No, not right now.
Right. So I'll explain tomorrow, right? So every step tomorrow onwards, whatever BA steps, procedures, and how because what kind of questions, like how you have to explain practically, that
Okay.
we are discussing from tomorrow onwards. Okay.
Okay. All right. Thank you, Raj.
Thank you, Shalini.
Okay. Bye-bye.